Hello friends, myself Dr.Manish. Today I am going to talk something regarding anemia and postpartum hemorrhage. What we mean by postpartum hemorrhage? When there is more than 500 ml of blood loss in normal delivery or more than 1000 ml of blood loss during cesarean section is considered as a postpartum hemorrhage. Recently we have got very bad incidents in India that one gynec doctor has committed suicide because of postpartum hemorrhage. So imagine the gravity of situation. Postpartum hemorrhage is very common in any delivery, either risk factor or any risk factor, women can go for postpartum hemorrhage. If you see in India, more than 33% of women are suffering from postpartum hemorrhage. There are 4 different causes of postpartum hemorrhage. There are 4 T: tissue, trauma, thrombin and tone. To recover of all these 4, most common is stone. When there is uterus is atonic, you should have a motive in your mind. What we mean by motive? Massage the uterus, use tranexamic acid, use oxytocin and evaluate the genital tract. For controlling atonic PPH, we have got so many drugs available in our hand, starting from oxytocin, methyle ergometrine, Prostgalndine and recently Carbetocine. Carbetocine is the molecule which is just like oxytocin analog. We have to dilute this Carbetocine in 10 ml of normal saline and we have to give it very slowly. 1 injection of Carbetocine is equivalent to 16 injection of oxytocin, 2 injections of methyl ergometrine and 1 injection of prostaglandin. So with 1 injection you can have a very good tone of the uterus. But even though after giving this medication uterus is atonic, then you have to go for systematic devascularization of the uterus, starting from ligation of the uterine artery, ligation of the ovarian artery, ligation of the internal iliac artery, and even though bleeding doesn't stop, then sometimes we have to go for hysterectomy, that is the ultimate, remove the uterus when there is totally atonic uterus. But once there is a tear like cervical tear, vaginal tear, deep cervical tear, we have to suture this cervical tear with different variety of suturing. When it comes to thrombin, then we have to treat all this patient with antithrombin, and some tissue remain there inside the uterine cavity, either placental beads, cotyledon or membrane, then we have to remove it. If we have got something risk factor like postpartum hemorrhage, particularly in the cases of pregnancy induced hypertension, IUGR, twin pregnancy, or when there is over distension of the uterus with diabetes mellitus pregnancy, that is macrosomia, or polyhydramnios, then we have to consider postpartum hemorrhage in our mind. Prevention is better than cure, and you can use all the modalities of medical treatment as well as surgical treatment to make this woman happy, and she should not die because of PPH. There should be no another Taj Mahal in India, because we all know Taj Mahal is built in the memory of Mumtaz and she died in postpartum hemorrhage. Thank you.